So East meets West. My good friend Chris Bunick, who is at Yale, does a tremendous amount of basic science research and clinical work, and Jim Rosso, a dermatologist that runs a research center in Las Vegas, Nevada. And we both have a very strong interest in oral antibiotics and other therapies for acne and other disease states also. But what's really exciting at this meeting is we're both getting the opportunity to talk about antibiotics, and I'm discussing where antibiotics fit in and thinking about how we could responsibly use oral antibiotics, focusing on the management of acne and thinking about what we're doing and not just habitually doing things. But Chris, you have come up with some first time really exciting information, specifically with regard to Cutibacterium acnes. So I'd love to hear more about that. I'm sure everybody else would.
Yeah, well, thank you, Jim. My research laboratory at Yale has done a pretty remarkable study evaluating Cutibacterium acnes and looking at the target of antibiotics that we routinely use in dermatology to treat acne vulgaris. It's hard to imagine, but for the last 50 years, we've been using antibiotics to treat acne, thinking that we're targeting Cutibacterium acnes, but not actually knowing the mechanism of how these drugs are interacting with their target, which is the ribosome, the protein machine that makes all the proteins within the bacteria and in our cells as well.
So this is the first time it's been done with Cutibacterium
This is the
acnes?
first time ever that we have a structure of the Cutibacterium acnes ribosome. And we did it with the structure bound to Sarecycline, which is our narrow spectrum antibiotic for acne vulgaris. And we discovered something completely unexpected, that there's a second active site where Sarecycline binds. So we have a canonical or the original binding site that helps gum up the reading of the messenger RNA codons. And now we have a second active site in the peptidyltransferase center where the growing protein is occurring in the ribosome. So one drug, narrow spectrum, two active sites hitting the pathogenic bacterium in acne vulgaris.
So you have a jab and a right cross.
Exactly.
Basically. So I would imagine that this has an influence on antibiotic resistance, because having mutations at two places is a lot less likely than one.
That's exactly well said.
That.
Well said, Jim. This is exactly one of the major implications of our findings, is that we in dermatology want to practice antibiotic stewardship. But antibiotic stewardship doesn't mean don't use antibiotics. It means use them smartly. And one way we can use them smartly is using narrow spectrum antibiotics like Sarecycline. And what our research shows is Sarecycline is known to have one of the lowest, if not the lowest, propensity to cause antibiotic resistance. And our research shows that with these two active sites, you're exactly right, Jim, that you have to now have mutations in two locations, which is highly improbable, in order to get that antibiotic resistance by a mutation mechanism in Cutibacterium acnes.
One other question I have for you, do we know that that's different than other tetracyclines, for example, like doxycycline and minocycline, in terms of their binding sites, or do we not know that yet on C acnes?
Right. So on Cutibacterium acnes, how the narrow spectrum Sarecycline's mechanism compares to some of the other oral agents is not known yet, but that's an active area of research that my laboratory is interested in.
So there's more to go.
There's more to come.
Thank you, Chris.
Thank you, Jim. My pleasure.
Great.